Thank you very much, Helen and Linda, both. Just before we get to the question and answer period, we thought we might put up a polling question. And we haven't done any polling questions the whole webinar, but it dawned on me as questions were coming through and as some chat was happening that we really should draw on the people who are online and the information that you presented and see what people think. So this is just meant to be open brainstorming. You know, what are some ideas that practitioners could, you know, take action on climate change and health equity? What are some things we could do in our practice? So as a lot of you know, I'm all about the practical, you know, what can we do when we go back to our desk and to our work? And, you know, how can then that work maybe address equity and health equity or take a social determinants lens? So I'm going to leave this up as we start into the question answer, and I can share the suggestions for everybody. There's been a couple of requests for me to share the resources and comments, which I will do, and certainly these ideas for action I can share as well, because maybe, you know, sometimes we get good ideas from each other, and maybe it will just help us to sorry, my voice, will help us figure out, you know, sort of how to take action. So, so please, if you can think of things as we talk in the next few minutes, that would be great. And I am going to go to our questions. So let me just get to the top of my list here. Okay, so if our speakers can unmute their lines to respond. We have a question here. Shezadali had commented that as a student, they're hopeful that you know, there are people that will already and continue to address these factors, and that we're in a really good position to make some change. So the question is, do we have any strategies that can be used alongside sharing evidence? So this is a little bit what we're pulling out here, but along with sharing evidence that might be effective to speak with individuals or groups that deny climate change. So, you know, maybe approaches on how we could frame climate change to appeal to the other side. Kind of makes me think of the fluoridation and water debate as well. But anyway, so any comments around that? And certainly people can suggest that in the polling question. That would be great too.
Helen, I can start.
Go ahead, Helen.
So I often get asked this question, and my response is always, what is it that is motivating the person that's asking that question? Is it economic? Is it what other reasons? So because there's so many co-benefits to acting on climate change, even if they don't believe in climate change, when you think about all the benefits of, if it's green energy, like that there's lots of jobs in green energy. If it's physical activity, there's going to be benefits from addressing climate change through physical activity. So I try and gear the conversation towards what is motivating them and identifying the benefits from that perspective.
This is Linda. A couple of thoughts. One is that there has been some research done in Canada looking at how Canadians view climate change, and there's a very small segment, at least in the one study that I saw, of Canadians who are doubtful about the existence of climate change. So although some of the climate deniers may be quite vocal, they're not representative of the larger population. And I think that, you know, we've always sort of been up against people, whether it's the tobacco industry or now the fossil fuels industry, that want to avoid science that demonstrates significant risks where the responses would impact profits. I think that's part of the history of public health from its get-go. So I think really take advantage, and I say that word advisedly, of situations where people are seeing the impacts of climate change, whether that's wildfire smoke. We had weeks here in California where our air quality was worse than Beijing or Delhi because of wildfire smoke. And that was a wake-up for a lot of people that, you know, this has never happened before, and now we're having this every year. That was an opportunity for people that really understand that these events are linked to climate change to make those links. And then I just really, really agree with Helen that talking to people about how to make changes in our communities that will improve health and simultaneously address climate change can be very compelling. It's kind of like, why is it that we would not make a change that would prevent childhood asthma or prevent childhood obesity? And I think to draw on the co-benefits of climate action, still keeping in mind what the links are with climate change, but the co-benefits for reducing health inequities and chronic illness can also be really powerful.
That's great. Thank you very, very much. That's really helpful. So we have a question from David. He asked, how can local health departments work on and impact system change? So, you know, working together on messages with other local health departments, working with schools, he really liked that information, but what about affecting government policy?
Helen, I can start it. Go ahead, Linda.
Go ahead. No, go ahead. I'll chime in after you.
Great. So I think, and when I was, I'm retired now, but when I was working, I found that being part of the Ontario Public Health Association certainly helped, because I had colleagues that were working in other health units and maybe within their own jurisdiction and at their place of employment, it wasn't as easy to advocate, but through a nonprofit public health organization association, we were able to do that. So earlier on in my slides, I presented examples, and I think there were 6 different climate change acts and policies that we had an opportunity to comment on. We had an opportunity to meet with the Provincial Minister of the Environment a couple of years ago through the Ontario Public Health Association, and we asked local health units for their input so that we can bring that to the table. So whether it might be more difficult for local health units to be meeting with provincial or federal ministers, there's an opportunity if you're part of a provincial organization like alPHa.
So I think, this is Linda, I talked really briefly about this concept of health in all policies, and I'm not very familiar with how that's being implemented in Ontario or in other parts of Canada, but it's becoming much more common here in the U.S. To really see task forces or commissions or working groups form within local government that bring together groups of staff from different departments to address problems where there's some common challenges and the potential for working across sectors to address a particular issue. And I think that's one way, and I'll come back to that in a moment. I think the other thing that's really super important that I also mentioned is working with impacted communities so that they understand the connections between some of what they're seeing and climate change, and also so that they are building their own capacity to speak for policies and programs that improve their health and well-being. I don't think health departments can do this alone. I think we need to be partnering in government and partnering with communities to get those systems changes. And our roles are, again, what we do. We can provide data that can help communities understand what's happening or help other agencies understand, you know, how what they're doing actually impacts health. In my experience working in California State, I found that when staff and other agencies got it that their work had a really big impact on the health of their community, they they want to do the right thing. They want to create healthier communities too. They live in our communities. And so I think there's been some really powerful change in California as the result of more structured and intentional guided conversation across agencies to look at what is it that the transportation agency can do to address health and to address climate change. What are the barriers there that perhaps another department can help with them? And then learning how to work, again, really closely with impacted communities. And I know there's another question about working with indigenous communities that I will defer to Helen, but those are my thoughts.
I just wanted to add too, Linda, the other thing that's a tool we have in Ontario, the Public Health Standards again, in the Healthy Environments guideline, it speaks to reviewing official plans and incorporating or recommending for official plans to have climate resilient policies. So health units across Ontario are getting more and more engaged in the official plan and the land use planning process, and planners for the most part are quite open to have that conversation and to incorporate with evidence some of the information that the health units are providing. And certainly when it comes to shade and climate resiliency, we have an opportunity to impact system change in that way at the local community.
Okay, that's great. There's just so much potential. And you might have touched on this next question already. There was a question from Rachel. How can we effectively engage at the local department level when provincial governments are resisting climate action? Have you maybe addressed that?
Well, I'll just give you an example. Maricopa County, that's where Phoenix is, an extremely conservative neighborhood, so to speak. A lot of climate denial and very impacted. So they were not using the word climate change in their work. They were afraid to use the word climate change because of the political environment and who their elected officials were that really oversee their department. They started by doing this survey of homebound individuals, and to do that, they reached out to a lot of people that interact with homebound individuals. They took the results of that survey and used it to start a conversation amongst the stakeholders and found that a lot of people were really concerned about climate change and no one was talking about it. And about a year to 18 months later, they decided that they should do a symposium on climate change and health. They were afraid to label it as such, and they had a lot of conversation within their department and within their management structure, and eventually they did decide to call it Bridging Climate and Health, and they invited a lot of people. They got no adverse reaction from any of their electeds, and a lot of people in the community and in the other agencies that were there said, we're so glad that somebody's finally talking about this because we're worried about it. And that led to much greater engagement, again, across a pretty broad spectrum of agencies and community organizations that has allowed them to broaden out their work from heat and homebound individuals to a much more comprehensive approach. So I think it's important for public health people to take leadership on owning this issue, talking about it from the public health perspective. This is happening. It's impacting the health in our community, and as public health, we need to do something about it. Let's talk about what that looks like.
Oh, that's great. We have a question from Jeff. So towards the beginning of the webinar, Linda, I think, talked about the bold youth leaders and making statements around climate change and the impact of climate change. So I guess the question is, how are public health authorities, public health units, regional authorities, how are they engaging with youth leadership? How are they helping build capacity for youth leadership, including but maybe especially Indigenous youth around this issue? And is that a source of public health action?
so this is Helen. I think it certainly is, and maybe that's an area we have to pay a lot more attention. That generation that's going to be suffering, and the next generation that's going to be suffering from what we're doing today. So there's so much potential there, and we know they're an energetic audience that really wants to help. So I know in the schools there are school programs that educate about climate change, but I would say that that's really, we can't let that be a missed opportunity.
Okay. And I think, when I think of my own son who's 15, and, it was very powerful in that quote that she said, we need to protect, what I can't remember the words, but the whole concept of going to school to be learning, but, we're in a world where, that might not exist or might not be very healthy in the long term. And so, that's a really powerful thought. We had a question from Amanda that so climate change can be a really difficult topic to engage communities. So are there examples of public health engagement that have taken the approach to, I'm just trying to make sense of the question. It can often be more effective to work towards something desirable than away from something undesired, right? So how do we sort of flip it to be strengths-based towards something positive? Yeah, and are there some examples you can share? Sorry,
yeah, for me, that's one of the really exciting things about working on climate change. I mean, it can, and there's a few other questions sort of talking about, like, wow, this can be really overwhelming. How do you keep all the bad news from being overwhelming for people in the community? But the good thing about it is, as Lancet and World Health Organization and, IPCC all point out, that the health benefits of climate action are just really remarkable. So, and the other thing I like about it is that across every area of public health, we're already doing work that can be linked to climate change and that gives people opportunities for positive change. So, transportation is now the largest sector for emissions in the U.S. and in California. Transportation's over 40% of our emissions. So we can build out our electric vehicle infrastructure and stop using diesel buses, and that all has, and keep working for low carbon fuel standards and automobile efficiency. All those things will both reduce greenhouse gas emissions and reduce air pollution with all of its attendant health benefits. But the biggest benefits from a health perspective in addressing the transportation greenhouse gas emissions are by increasing walking, bicycling, and public transportation. There's a lot of health departments that are already working on those issues: safe routes to schools, increasing physical activity in daily life, because we know that they have huge impacts on cardiovascular disease, on diabetes, on obesity, on osteoporosis, on mental health and well-being. So, the same thing with developing healthier local food systems and making connections with the agricultural community to reduce water pollution from nitrate fertilizer, or make healthy fruits and vegetables more available, or do rotational grazing so that we build up healthy soils. There's, in every aspect of addressing climate change, there's a way to do that, but there's ways to do that that really allow us in public health to join in supporting those efforts by pointing out to people all the benefits we get for health.
Yeah, it's really building it in, right?
I wanted to add that this doesn't sound positive, but to take advantage of extreme weather events when they happen. So when, whether it's a flood or extreme heat event that lasts for 7 days, like in Montreal where 90 people died, when those events happen, the media isn't paying enough attention to linking it to climate change, and perhaps public health isn't either. So it's really important, we say, when we talk about this, it's important you protect yourself from extreme heat as these events are happening more and more because of climate change. And also through OPHA's health-focused climate communication messaging, we want to talk about things that maybe people don't necessarily associate with climate change, like Lyme's disease. So the number of Lyme's disease cases are going up. We want to engage the public through those messages because they're very concerned about their children getting Lyme disease. Then how do we link that to climate change, and then the need to act to reduce emissions because we want to protect ourselves and we want to protect future generations.
It's building it in really to a lot of the work that we're doing already, I think, in public health. And, in a way, it makes me think of the points around communication a little earlier, that, we're communicating to people based on the issues that are most important to them, right? And so it's the framing of it. And
when we started the vulnerability assessment, when I was still working, we met with all the different teams at the health unit. So our vector-borne disease surveillance team, our food safety team, our chronic disease prevention team, child health team, and we started the conversation. It was difficult for them to identify how their program would be influenced by climate change, but after an hour or two, we couldn't believe all the discussion that came out about certainly everything we're doing. Climate change could be impacting this, or we could be contributing to the evidence of this. So it certainly links to all public health programs.
Yeah. So we have a question from Christine. How should we balance climate change mitigation strategies with adaptation efforts?
That's a super important question, and the answer is that we have to do both. I think there's a compelling case to be made for the fact that if we don't really ramp up our mitigation efforts, our adaptation efforts will be overwhelmed. And so, and because we're already seeing the impacts, we can't not do adaptation. There's some strategies that are both adaptation and mitigation. Planting trees, for example, using green infrastructure. I think you can make a good case for anything that reduces co-air pollution, carbon and other air pollutants, because we know that people that already have a lot of exposure to air pollution have higher rates of respiratory disease and cardiovascular disease. That puts them at greater risk from higher ozone levels or from wildfire smoke. So, these things are in a way enmeshed, and I think we need to talk about both because particularly in my experience, public officials go really quickly to what should we do the next time that there's wildfire smoke. And that's a super important issue, but it has to be linked with taking action to reduce warming so that we don't just keep making wildfires bigger and more frequent and more catastrophic through reducing emissions. So the balance for me is finding whatever opportunity I can to enter into a conversation about climate action across the waterfront, and then being opportunistic about where there's an opportunity to move on a particular policy or program that's going to address climate change from either perspective.
Yeah, I would definitely agree. I think of the example of air pollution. I mentioned about 14,000 people dying per year from air pollution in Canada. If we can reduce traffic-related air pollution and increase active transportation, we're reducing greenhouse gases as well, so that's a mitigation effort, but we're also adapting to climate change because air pollution or climate change is going to exacerbate air pollution, so we're doing both at the same time. And same with shade. Planting more trees provides shade for reducing urban heat islands and surface temperature, but also for reducing skin cancer, so it's both mitigation and adaptation.
Okay, we have a few more questions, and our time's ticking. So let's see if we can get through a couple of more. We've got a question from Nicole. How do we weigh in on policies and current events that don't seem to be directly related to health, even when we know that they are? So she references to that, right now there's a truck convoy on its way to Ottawa in support of pipelines. She's from Saskatchewan, where carbon tax is really unpopular politically. So, so how do, when we're in public health, how do we do that kind of work on issues that might not be really popular and draw that attention to the health impact?
Mm-hmm. So Helen, I was listening to that this morning on CBC, and I was thinking just that, like how you can tell how passionate people are when they're protesting against something and they're feeling like they're not being listened to. And so they, in the Lancet report that Linda had mentioned earlier, the policy briefing, one of the things they talk about is a just transition. So people that are working in the fossil fuel industry, that's their livelihood, and that is a health equity issue. If there's a way that the government can support and communities can support a just transition to jobs that are cleaner jobs, I think that's one way of trying to tackle the concerns people have that this is going to be devastating to the economy and to their own livelihoods.
Yeah, it's tricky, right? What are some of
the... I agree with that. Oh, I was going to say, I agree with that. And then yeah, I totally agree with that. And then I also think that, we can do health impact assessments of the impacts of pipelines on the communities around the pipelines. We can do health impact assessments like the one that I referenced that was done on rail transport of coal, so that we start to educate communities and policymakers that there's not just climate impacts from building a new pipeline, there's also actually local health impacts, and that it sort of pushes the conversation in a different direction to, try and balance the really legitimate jobs and economic security concerns with the health concerns and the climate concerns.
Okay. I'm just looking at our list here. I think we have one more question here. It might have already been answered in one of the previous ones. Caroline is asking, what are some effective ways to address mental health impacts of climate change into health policy? So like disaster response. And a number of public health policy. I mean, mental health mental health promotion, especially, is a big topic in public health practice right now. So, are there any further comments on addressing that?
I'll comment super quickly. One, I think that we can try and really identify ways in which we can integrate building social cohesion into the work across our public health programs, like when we're working with mothers and children, or we're doing work in schools, or working with people with chronic illness, figure out if there's ways to bring people together and build social relationships, because we know that in climate-related disasters, social cohesion has a big impact on the ability of communities, both in the response phase and in the building backstage. The resilience really makes a difference. And the second is building community capacity to be engaged in discussions about what happens in their own communities, because that is one of the most important ways for people to feel like they can actually do something about climate change and not feel disempowered. And the third is to make sure that we engage mental health practitioners when we're talking about disaster response, and make mental health services available. That's been a big problem in the wildfires here in California, that we learned from how important it is to make those services available immediately.
And I think to recognize the research that's out there in the Alberta fires, I think it was Alberta floods in 2013, the Public Health Department did surveillance on pharmaceutical use. So people are going, they saw a very high rate of getting sleep aids or other maybe antidepressant drugs or going to the doctors more often. And there was also research after 2011 in northern Ontario, forest fires where there was communities that were evacuated. There was research about the impacts to mental health from that community. And I think just paying attention to that research and recognizing you have to put those, like Linda mentioned, put those systems in place that if you need to evacuate a community, that you're paying attention to the needs of the community when you're moving them elsewhere and how those impact not just going to last for days or weeks, they could last for years.
Okay. Well, I think that takes us to our time, everyone. Went really, really fast. So I just want to say a huge thank you to all of our speakers, to Monika Dutt and Linda Rudolph and Helen Doyle.